Convergence 2023 is just around the corner, folks. We're working nearly around the clock to make sure that your meeting this year is the best experience yet. Come to San Diego, California to enjoy the unveiling of cutting-edge science in our field with friends and colleagues. Join us from November 10th to the 15th. Registration is now open at rheumatology.org.
Welcome to ACR On Air, the official podcast of the American College of Rheumatology, where we have engaging conversations with leading rheumatology professionals on topics such as the latest research on rheumatic diseases, solutions for addressing practice management issues, legislative policies impacting patient care, and more. Here's your host.
Welcome back to another episode of ACR On Air, the official podcast of the American College of Rheumatology. I'm your host, Dr. John Hausman. Show notes for this episode can be found at acronair.org. You can also find our previous episodes on Apple Podcast, Spotify, and on your favorite podcast app. I always thought of myself as an advocate for my patients. I mean, in the clinic room and within my hospital system, I work hard on behalf of my patients to make sure that they receive the care that they need. This often means coordinating with other specialists to optimize a patient's care, fighting with insurance companies for prior authorization, providing letters for schools or employers explaining a patient's condition, and, of course, much more. However, I often encounter challenges that are difficult to overcome, such as when patients have low English proficiency and have difficulties in navigating the healthcare system, when they lack adequate financial resources to afford their medications, or when they are underinsured or uninsured and cannot even access the expertise they need. I have to admit that some of these tasks sometimes leave me feeling overwhelmed and helpless. Fortunately, there's still a lot that we can do to make a difference for our patients' lives outside the hospital walls. And the funny thing is that these same actions can also help us to overcome feelings of helplessness and burnout. Today, we revisit advocacy within the American College of Rheumatology. We've invited Dr. Belinda Birnbaum, member of the ACR Government Affairs Committee, and Lennie Shewmaker McDaniel, the ACR's Director of Congressional Affairs, to talk about the many things that the ACR is doing on behalf of patients and rheumatologists. We'll demystify the world of advocacy, explain what RheumPAC is and the various ACR committees that are helping to identify the issues that most matter to us. We'll highlight some of the past successes of the ACR's advocacy work and discuss important issues that are currently being presented to Congress, including transparency within pharmacy benefit managers and challenges of step therapy. Most importantly, we discuss how you, the listener, can actively participate and become involved in this important work. Dr. Belinda Birnbaum is an academic turned community rheumatologist within the Bryn Mawr Medical Specialists, and she currently serves on the ACR Government Affairs Committee. She's co-founder of Physicians for a Healthy Pennsylvania and completed a civic health fellowship with Vote ER, an organization that believes that voter registration should be part of healthcare. We'll discuss about this involvement within the episode. Lennie Shewmaker McDaniel is head of the ACR's DC office and the Director of Congressional Affairs. She was previously a legislative staff member managing healthcare for a member of the House Majority Leadership. She then decided to obtain her JD from the University of Georgia Law School and is a member of the State Bar of Georgia. I have to admit that the whole topic of advocacy can sometimes feel overwhelming or even boring. But trust me when I say that Belinda and Lennie really help to bring these issues to life. And I think that Like me, you'll find them much more interesting than expected. Enjoy. Belinda and Lennie, welcome to the show.
Thanks for having us.
Happy to be here.
Belinda, how did you become involved in advocacy?
Well, advocacy can be defined so broadly. It's really just the act of supporting a specific cause or policy, and we all do it to some extent daily. Rheumatologists are actually great natural advocates. Think about every peer-to-peer call we do, that's advocacy. I'm currently on call this weekend seeing consults in the hospital. And how many times have we talked to a hospital service about our patients who we thought needed more steroids or more often than not didn't need steroids at all? Anytime we're doing that, we're advocating for our patients. And you've talked recently about advocacy on your podcast. You talked to Irene Blanco about highlighting disparities in our patients and our workforce, arguing for equity and inclusion. You had Paul Della Ripa on here talking about climate change and extreme weather and how that affects rheumatology patients. So anything we really do can be advocacy. There's a quote that I like by Rudolf Virchow. He's the founding father of pathology. And he said that medicine is a social science and politics is nothing but medicine on a larger scale. And I'm kind of here for that. We've always heard that doctors should be apolitical and we shouldn't let politics enter our exam room. But really, there's no realistic way for that to happen anymore. To say we're above the fray or not interested or don't have time, when I thought about it, is really to be complicit in all the problems that affect us. So I was told for years to join the American College of Rheumatology by Joan von Felt, who's the former president and a mentor of mine. But I really said to her, I don't have time. But, I was busy in clinic and education and raising my kids. And, I kind of regret that it took me over a decade to listen to her. I came to advocacy late into my rheumatology career. But the world's been pretty hectic for the past 8 years or so, and we're all kind of weary, right? We're dealing with the barriers to us practicing and being the best doctors we can be. And there's a lot that's going on that's making medicine less enjoyable than we want it to be. When we talk about moral injury in medicine and how that leads to burnout, it occurs when we can't prevent or have no control over acts and actions that are conflicting with our values and beliefs, right? So think about how angry and frustrated we get when we sit in our exam rooms and we're talking with our patients. And we spend so much time talking about copays, access to medications. We're grappling with social determinants of health like food and transportation insecurity. These days, many of us are living in states that restrict abortion access. And so it's really just hard to say. I find it really hard to say, well, the system sucks, right? And just move on. All these things conflict with who we want to be as doctors, and it depletes us. And so advocacy is the best way I know how to combat moral injury. And especially when it's done with peers, it really can increase the sense of community and purpose. And it's just kind of taking action. The first formal thing I did was join a group called Vote ER. It's an organization who really believes that voting belongs in the healthcare realm and that people in healthcare should really encourage our patients to vote. There's 50 million unregistered voters in the United States, and there's a great overlap with those who are most vulnerable and most marginalized in our society. And so what I started to do was ask my patients if they were registered to vote, right? It's a very nonpartisan question. I went further and did a civic health fellowship with this organization, learning how to effectively community organize, essentially, so that we can work to make change. Can I share troubling statistics with you?
Absolutely. That's what this podcast is all about.
Well, so you're ready for this one? Doctors on the whole vote 9% less than the general population.
What?
Yep. And actually 22% less than attorneys, right? So,
oh my goodness.
I know. So, if we're not voting, we're not going to have a say. So I started to take this pretty seriously. Interestingly, in 2022, the AMA, and I guess we're going to talk about the American Medical Association later.
Yep.
But they put out a position statement saying that voting is actually a social determinant of health. And so I realized that when I'm doing advocacy work, I actually feel pretty good. I feel much better about my job as a doctor. And really, that's how I started. And then a year or two later, I came to the ACR to be part of their government affairs committee.
Amazing. That's an amazing story. And I love a lot of the things that you mentioned, including sort of viewing government, you mentioned, or politics as healthcare in a larger scale, and how sometimes by getting involved in advocacy, maybe you're able to overcome some of that feeling of burnout, right? Of helplessness that we sometimes feel when we encounter patients and we encounter those barriers that prevent us from, prescribing the medications that we think our patients need. And how, maybe by getting involved with some of these groups, not only does it make us feel better, but hopefully it can actually lead to change. So that's an awesome story, Belinda. What about you, Lennie? How did you become involved in this world of advocacy?
Yeah, so I graduated from college and loved DC more than I loved any sort of particular career path. So I had interned there one summer in college and took a job up there as an intern in a congressional office. At that point, it was if you were from a member of Congress's hometown, they would give you an unpaid position for a second. And I got swept up into the process. I ended up working for that campaign. One of the things that really struck me is as constituents and other members of Congress approached the person that I was working for about different issues, every issue I was struck by, oh, that's an issue in the world that I have encountered that it really hadn't occurred to me could be solved or mitigated through law. So I did it as a job for a long time in DC. I worked for a few members of Congress, and the final member of Congress I worked for, I had a very broad portfolio of issues that I was kind of the policy go-to on. And when he was appointed to the Ways and Means Committee, that policy issue bucket narrowed to basically healthcare, women's issues, and things related to healthcare that would be brought up in that committee, which narrowed my focus. And then I went to law school to really understand the nuts and bolts of why, when written in a certain way, a piece of legislation can be misinterpreted by an agency, or it leaves it open to interpretation. So then after law school, I decided that policy seemed like a more appealing career than traditional law, and feel lucky to now, as a job, be completely in-house with the American College of Rheumatology, which means that my entire career is focused on policy issues that impact rheumatologists, rheumatology care providers, and rheumatic disease patients, which is a subject area that needs a lot of support considering the size of the patient population, the struggles of the people trying to serve them. So it's been a great road, and I really enjoy working on these topics and feel really good about what it means for my contributions to the world. But it also means I can feel really good walking into a member of Congress's office, knowing that what I'm asking for is genuinely good for the population and for America at large.
That's great, because it sounds like we have somebody that's been on the other side, right? You've been working with Congress people on some of these issues, and now you're bringing sort of our needs and requests into government. And I'm sure that your experiences allow you to work much more effectively. So we've talked about advocacy, but how does advocacy fit in within the mission of the ACR?
Well, I'll take that one if that's okay.
Yeah, go for it.
I've been a rheumatologist, like I said, for 20 years almost. And I have spent the first 15 of those in academic settings and only the last 5 in community practice. So I was in this academic bubble for a long time, ensconced in clinic and RVUs and house staff education. If you asked me at the beginning of my career what the ACR does, I would have said, oh, they put on annual meetings and other conferences. They make a lot of guidelines. They publish journals. They have educational handouts that I give my patients. But there's this very important piece that the ACR does, and it's the advocacy piece. A good part of the ACR is heavily devoted to making sure we rheumatologists can do our jobs well by advocating for us. Lennie is there meeting with congressional staffers and legislators. Again, everything is politics. Everything we want to get done to make us better doctors and to help us take better care of our patients, to grow our workforce, everything requires discussions with our elected legislators.
And I will say I've been really excited to watch the ACR grow in this space. When I was hired, I worked entirely out of the Atlanta office and was the only staff person dedicated to federal issues. The Political Action Committee was in its infancy and didn't have a lot of traction. Since that time, I've been here for 8 years. We have grown to a team of 5. We opened an office in DC where we are based. So, and the PAC has expanded, which while political action committees can get a bad reputation, RheumPAC allows us to, or RheumPAC allows our team to access legislators and have conversations, which during every Congress has a different profile. Every Congress has a different approach. And this Congress especially is incredibly shielded and wants only staff to interact with, especially lobbyists. And the Political Action Committee gets us access to breakfasts, dinners, lunches, where we sit in small groups with a member of Congress and are really able to dive into the details of why our policies make sense, what we're asking for, what the patient needs are. And it's unfortunate, but that's the American system. Without that aspect of your advocacy, you're really cutting your nose off to spite your face in terms of access. So, you can have the best arguments in the world, but they truly cannot be heard as effectively without the Political Action Committee piece. So I'm really proud of the fact that we have opened the DC office and grown our team. And I feel like our team now reflects really the importance of the issues and has the ability to advocate, not just to Congress, which is where my focus is, but we have a member of the staff that's completely dedicated to issues at the state level. We have a member of our staff that's completely dedicated to, once Congress passes a bill and that bill is passed on to the agencies to decipher and turn into rules, which are the rules that dictate Medicare, which dictate Medicaid, which dictate NIH funding. Once that legislation is passed over to the agencies, we have a member of our staff that's completely dedicated to watching those laws become rules and monitoring and submitting comments on that process. So we really try to make sure that we are covering the full gamut of policymaking, which I think when volunteers do start to get involved, like Belinda, is shocking to them at how big of an impact advocacy has in general, how much public policy comes into play in your day-to-day professional lives, and how many incredibly well-educated with and totally competent with amazing backgrounds in health policy people we have that are full-time staff with the ACR really working on these topics.
That's awesome. I know that the ACR has sort of several arms that are working in advocacy, and you mentioned RheumPAC is one of them. For people that aren't as knowledgeable about what political action committees are, can you explain to us what exactly it is and how listeners can get involved with RheumPAC in specific?
Sure. So at annual meeting, we often get a lot of questions from people that basically say, we don't want our dues to be used for politics. And the good news for them is it's actually illegal to use any dues funding for political activity. So in order to support the measures that we're talking about, that's why political action committees are really beneficial to associations like ours. Many medical specialties, in fact, all of the ones that we work with have one. And a political action committee is a closed cast, which means only members of the ACR and the ARP can contribute to it. So we can't take any outside funding. It is just members of the ACR and the ARP that want to support public policy makers who have supported public policy that helps our doctors and patients. It's a small PAC, so we don't give a lot of times to even leadership. We just don't have the capacity, and leadership truly isn't who moves legislation through. So we pick really effective members of committees of jurisdiction who are moving pieces of legislation like prior authorization reform, like step therapy reform, like PBM transparency, issues that every year the Government Affairs Committee ranks for us, tells us what's most important. And then we follow those policies and the people who support those policies, because a lot of times it takes many Congresses to get a bill through. So the same people who support those policies this Congress, we want to come back next Congress because historically speaking, they will support it again. And the more people we have behind a bill, the more likely it is to pass. So the Political Action Committee allows us to first and foremost educate members of Congress on the importance of those issues and what we'd like to see in those policies, but also to make sure that once we've educated a member of Congress, we don't lose them and have to start over with a brand new face once they've committed to understanding the importance of these policies to this huge patient population and the doctors that serve them.
And again, I'll say in terms of RheumPAC, as an early career rheumatologist, when I saw it, my thinking was, well, I'm already paying ACR dues. Why should I give extra to RheumPAC? And it's really only with education and learning about all the advocacy work that really they do. They're meeting with potential candidates. They're meeting with people who are already in Congress, both again on mostly on the federal level. And so if you can do nothing else, the smallest donation to our Rheumatology Political Action Committee goes a long way in just saying, here are the numbers of people. In addition to the amount that people donate, here are the numbers of our doctors, the percentage of our rheumatology profession who are donating, who think this is really, really important. And so, again, $10, $20, however much, hundreds, it doesn't matter. What matters is that you're showing, and what you're saying is, this is actually really important to us and how we practice medicine.
And as I understand it, it's a nonpartisan committee so that you don't support Democrats or Republicans. You support people that sort of are in line with the mission of the ACR and the goals that the ACR wants to achieve. Is that right?
Yeah, we have a RheumPAC committee, which is essentially a RheumPAC board of directors, and they use a scorecard to determine the viability of a member of Congress for support. Things that get you a boost on that scorecard include a history in the medical field, whether you were a physician or a nurse or just someone more familiar with our issues to begin with, committees that you serve on, if you're a returning member of Congress, whether you've supported bills that we support in the past. They also have, for example, they took action after certain actions in Congress and said, we will not be supporting this small group after this particular act. And those have gone both ways for both parties. And at the end, we're really proud of the fact that our contributions tend to reflect the percentages in Congress. So if the Democrats have the majority in the House, then we've probably given slightly more money to Democrats in the House. And if the Republicans have a majority in the House, then we've probably given more money to Republicans that cycle, simply because somehow the way that we've configured it has been really effective at reflecting what Congress looks like, which is reflective of the policymakers' ability to move things through. So it is a scorecard-based system, and that scorecard changes as the Political Action Committee board changes. So they are able to, with the input of GAC as well, make sure that they're properly weighing factors that we feel are reflective of the membership at large in that decision making.
And the money itself, does that go to the campaigns of those people, and therefore that allows you FaceTime with some of those people or their staffers? Is that how, for better or for worse, the American system works?
Yeah, so I was a professional fundraiser for a while, and one of the things that I don't think we talk about enough is it requires almost $20,000 each day that you are in session. You have to make almost $20,000 a day just to fund a competitive campaign to run for Congress. So to keep these people in their congressional office and able to do their job and not have to spend their whole day on the phone fundraising to individual donors, organizations like ours team up with organizations with similar interests. For us, it's cognitive specialties and other providers that share a lot of our priorities. And we team up and we have lunches, dinners, coffees, where we all pool the kind of our PAC money together to say, we have really important issues we want to talk about. Here's some education on this topic. And now you've kind of done what you need to do for the day in order to fund this congressional campaign, which you can question the system all day long, but unfortunately that's where we're living, and they have to get the money to run a campaign from somewhere. So the Political Action Committee, it really allows us to make their lives slightly easier and get access that benefits our members. But they have to fundraise so aggressively every single day that they're in DC. And that's just a more effective way. And time-wise, you're going to get more time. If you schedule an appointment in a Hill office, which we do, to be clear, we spend a lot of time in Hill offices advocating directly to chiefs of staff and healthcare staffers. And that's where we talk about specific bills and things we would like to see. But for FaceTime with a member of Congress, where we're talking more about, hey, did you know how many arthritis patients are in your jurisdiction? Did you know how many, the wait time for a rheumatologist in your state, et cetera? Those conversations are brought to you by political action committee funds and really making their campaign fundraising lives slightly easier.
Yeah, Lennie, I mean, it's a crazy system. It reminds me of how pharmaceutical companies, at least in my hospitals, they used to come in and provide lunches and dinners and things to doctors, with education. In many academic settings, those are no longer allowed because clearly they influence our prescription patterns. But I agree with you. That's the way things are. And if we want our voice heard in DC, we got to play the game, and this is the game.
And your example is perfect because the Supreme Court kind of did the opposite when they ruled on Citizens United, which is they'll allow any influence as long as that influence isn't directly talking to the campaign. So now congressional campaigns cost even more money because at any point, a group, an unnamed group, unaffiliated with anybody, can just start running ads without consulting either campaign, without anyone's permission, can start mailers in their district without anyone being able to source the funding or the facts. So people running for Congress now need an even larger budget in case one of these dark money groups decides to attack them. You have to have the ability to work nimbly and have like pre-reserved TV time just in case someone is running ads against you. So it's become kind of the wild, wild west when it comes to campaigns, and it requires a lot of money to be able to act in response, especially when, there is not a lot of regulation on what you can and can't say. And because you don't have to be affiliated with any campaign to run these ads, you need a lot of space and time and resources to counter them because they don't start in a basis of my opponent says, because it's not your opponent. It's some unnamed group.
Yeah, it's crazy. But I'm glad that we have you working on these issues and that we have RheumPAC. So RheumPAC is sort of one of the arms of the ACR and advocacy. And I wanted to talk to Belinda about the Government Affairs Committee and, in specific about, what it does and how it's related to RheumPAC, if at all, and how it deals with DC and advocates for rheumatologists and for their patients.
So the Government Affairs Committee is a committee that, and if you look on the ACR website, there's a ton of different committees: education, workforce, research. And again, there's a few different advocacy committees. The Government Affairs Committee, or GAC, because who doesn't love a good acronym, is one of them. And basically, the GAC establishes liaisons with congressional members and staff, as well as with other organizations concerned with public policy aspects of healthcare, both healthcare delivery and healthcare financing. I was really excited to be appointed to the GAC a year and a half ago. So I'm 1.5 years into a 3-year commitment. It's been great so far. I think my knowledge of advocacy and rheumatology is on par with like a really good second-year resident, right? who kind of knows what they're talking about. You can leave them overnight in the ICU maybe, but you definitely want like the attending or like a Lennie to come in during the day and make sure what's going on. There's about 20 of us on the committee run by Christina Downey is the chair of the committee. I think you recently had her on a podcast to discuss wellness. We meet monthly. We talk about what issues are going on in Congress. We get updated from Lennie and other ACR staff where the ACR is in regards to a lot of the issues that we're trying to get discussed. We work on position papers, and those can be found on the ACR website as well. And we meet twice a year in DC, and we go to congressional offices and meet with staffers. Occasionally we'll meet with the actual legislator, and we talk about issues that are important to us as rheumatologists. We spend time planning which issues we think are most important, which ones are already visible, and we work on educating members of Congress. I'll tell you, when I first joined, it was like, oh, we're going to go talk to them about pharmacy benefit managers or copay accumulator programs, and they'll listen to us and the bill will get passed. But, that's just not how it works, right? And, as Lennie said, it's really these very small baby steps. And we serve important roles as educators, talking to staffers about what's going on with us. People really want to hear from doctors, it turns out. I'll say, and as an aside from the Government Affairs Committee, the voice we have as doctors, I think we sometimes forget how big it can be. It's still, despite everything going on in our country and our world in medicine, it's a privilege, right, to be a doctor. And I think along with that privilege comes both a moral and a civic obligation to take care of our patients, ourselves, and our communities. And people really take what we want to say and go with it. Staffers want to hear from us. So even if you're not on the ACR committee, if there's something that's bugging you, if you actually pick up the phone and call your member of Congress, they are very happy to meet with doctors and hear about what's going on. I routinely tell my patients who are pissed off that sitting in the office complaining to me isn't really going to achieve anything, right? Complaining is like a short-term benefit. It's like eating cookies, right? It feels good while you're doing it, but it doesn't get any long-term goal accomplished. And so it's really when we pick up the phone, when we call, when we talk, that's how the work gets done.
Fantastic. And I understand that there's a couple of issues that are going to be brought to Congress on September 27th. And I believe this episode is released on the 26th. So these are topics that are going to be brought about tomorrow. What are the couple of topics that the ACR has decided are important to address with Congress?
This particular fly-in, our September Advocates for Arthritis event, also brings patients to Washington, D.C. So our slate changes slightly from May, which is very provider and care team issue focused. And our September fly-in focuses on issues that also really impact patients and patient care. So we are focused on drug pricing. And right now, because of the interest that Congress has in it and the impact we think it's having, we're focused on pharmacy benefit manager transparency mechanisms. I think that it's really important, and the ACR thinks it's really important, and the GAC committee has told me that they think it's really important to understand the economics of this multi-billion-dollar industry that is. These organizations and these companies are repeatedly ranked in like the top 5 most lucrative companies on Forbes, and they're not delivering healthcare and they're not making anything.
So as I understand it, their role is just to increase prices on prescription drugs. Is that what they do?
They claim that they create discounts that are passed on to patients, but from the patient feedback we're getting, that's not happening either. So we think that that is definitely an area, as we're looking for savings in the healthcare space, that maybe some transparency around pharmacy benefit managers might shed some light on where some of the money is going, that insurers are saying insuring people is costing them and patients are saying they're paying pharmacies. We think that's a black hole that really requires some transparency. And we're very lucky that this Congress, both the Senate and the House, have started to put together packages with various pieces of legislation that would move this forward. So we think that that has momentum this year, which we're excited about. And one of those packages, the Senate package, already includes step therapy reform language. So we are also going to be highlighting the need for step therapy reform with those patients. We hear patient stories constantly about changing employers and therefore changing insurers and therefore having to restart their treatment because of step therapy protocols. And what we're asking for is just a series of very reasonable exceptions to step therapy requirements that say, if a patient is doing well on an existing medication, or if they've tried a medication in the past and already had a bad reaction to it, that they can be exempted from these protocol requirements. That, as I said, is already in a Senate package. So we're really excited to see if that can move through this year. Like I said earlier, every Congress has a different approach. The last couple of Congresses have been all about these huge legislative packages that you then angle to get language added to. So it's important for listeners to know that if you understand the Safe Step Act, which is our step therapy individual legislation, we may actually get step therapy reform passed in a large package, but the Safe Step Act will never show as passed. So the way Congress moves has changed, and they love a big package now. So we're having to be adaptive and really angle to get language that is important to us added to these larger moving bodies. We will also be highlighting, along with step therapy, usually comes prior authorization. So we'll be reminding them about our prioritization of prior authorization reform and how we would love to see that in one of these packages. And then this year, we have the executive committee kind of acting as a strike force on particular provider issue, which is Medicare reimbursement. The physician fee schedule came out. It's once again trying to claw back some physician reimbursement funds. The reimbursement for Medicare providers the charts are horrifying. Just the dip in what it costs to provide care versus the reimbursements. So we will have the executive committee going out and supporting a particular code update that helps in-office providers and really recognizes the expertise and care that is provided in the in-office setting for complex patients. So that's more on the regulatory side, but we will also be bringing that issue to the Hill because it is really important to providers and very timely because the physician fee schedule, whatever version CMS decides to implement, will start on January 1st. So we certainly don't want to leave that aspect unattended while we have all of these amazing volunteers and providers on the Hill in September.
Great. And Belinda, how do you sort of see these initiatives? How could they impact the care that you provide patients? Can you bring this down to the patient encounter and sort of, think about why these things are so important?
Yeah, it's interesting. When I remember my first few months on the GAC, I sat there listening to all the talk about PBMs and Medicare reimbursement. And I kept thinking, I really don't know if I'm educated enough to be the one talking about this. And in some sense, that you just have to get the big idea, right? So you can bring this all down to how it affects us as doctors and our patients kind of easily, right? So when Lennie talks about working towards Medicare reform, when you hear that reimbursement that was supposed to be cut by 8%, but after a lot of work is only now cut by, 4%, Lennie?
Yeah, 3.75.
Okay, 3.75. Yeah, so it's been, we're ahead of where it's not where we want it to be, but it's better, right? And so people in private practice, academic centers are getting better reimbursement. Medicare also plays a big role in our workforce shortage, right? Medicare decides how much money hospitals get for trainees. And so that's another thing that we work towards when we go there and we say, we have a shrinking workforce and we cannot grow it unless you allow for more slots, unless you increase Medicare funding, right? That's something that all of us can easily understand. When we talk about, again, these patients, having to sit there, a patient changes insurance, they're doing great on, I don't know, adalimumab, and all of a sudden they don't have access to it. And the insurance now will only cover, say like abatacept, right? I'm just making this up. And they've already been on that and that already didn't work. But the insurance wants, all of this stuff that we go through that frustrates the heck out of us day to day. And we see how this negatively impacts our patients and their ability to work and function. You can easily take all this stuff that's being done and bring it back to sitting in the exam room talking to a patient, and the ability to connect that and make it feel like it's something larger than what's happening in the exam room. It makes more sense to me, and it makes me feel like there's something we can do to change it, and it makes it less frustrating to deal with.
Yeah, that's great. Lennie, can you talk to us about some of the successes in past legislative, initiatives that have actually gone through and that have improved the lives of rheumatologists and patients with rheumatic diseases?
Sure. So one of my favorite examples, which happened actually a few years ago, but I still like to cite because when I was a staffer in many years ago, before law school, physicians used to come and advocate to me about repealing caps on outpatient Medicare therapies, the annual cap. And even as a staffer, I was like, that doesn't make any sense. We should repeal that. And of course, it didn't happen. 14, I think, Congresses later.
Wow.
I mean, not 14 Congresses since then, but I think they've been advocating for it for 14 Congresses by the time that they were actually repealed, which was something that we advocated for as the ACR and finally saw happen. I'm telling you, persistence.
Wow.
But more recently, one of our great examples is, you can't move the needle 100% in a day. You have to find your battles. And we were talking about the workforce shortage. We were specifically talking about the pediatric workforce shortage. And we found a program within the ACA that had been written into that legislation and passed. So it existed by law, but had never been funded. We were able to get a group together to advocate for funding. It only took us 2 Congresses. We finally got, a few $1 million to fund that program. And this July, the pediatric subspecialty loan repayment program started accepting applicants. That program allows for pediatric subspecialists to get a huge chunk of their loans paid off in exchange for working and serving underserved patient populations. So everyone wins. It's a program that already existed. We didn't have to reinvent the wheel. So, a lot of times the name of the game is being nimble and finding areas where when our members say to me, this is a priority, the workforce is an issue, pediatric workforce is a even more dramatic shortage, finding ways to move the ball even ever so slightly forward outside of just reforming the entire system, which is also a huge priority and we're working on, but obviously that takes longer. So those have been a couple of really great wins. Also this year, we have for the very first time gotten an arthritis specific line item included in the Department of Defense appropriations bill coming out of the House. Arthritis is the second leading cause of medical discharge from the armed services, second only to battlefield wounds. And it has no dedicated funding in the medical research program at the DoD. So we are very hopeful that somewhere in this funding the government discussion, the appropriations bill that includes that first time funding for research in that area moves through, because it's a very specific patient population and rheumatic disease is operating differently in that patient population than in the greater population. So we think research in that area will not only help armed services and veterans, but also the rheumatic disease patient population at large if conducted in the way the previous research has been done. So those are some recent wins that aren't covers of the Wall Street Journal or anything like that, but they're really impactful on our providers and patients. And we're really proud to be moving the needle every year, ever so slightly.
That's really fantastic and really encouraging. So how can I get involved as a rheumatologist, and how can patients get involved within the advocacy programs of the ACR?
I will say the Advocates for Arthritis fly in September each year. Applications open in the summer, but any member of ACR or ARP or their patients are welcome to apply to attend. It's a great way to get your foot in the door. I know that it can be incredibly intimidating when we say, we're going to fly you to DC and stick you in front of Congress. But I assure you there are hours and hours of discussion and training and prep. We never send you to a meeting alone. Also, as Belinda pointed out, I interact with Congress constantly as a policy professional. So if they need the nuts and bolts, my card and my contact information is in every folder, every handout that you'll have. So that frees up our patients and our doctors and our ARP members and care team members to say to a member of Congress, this is my experience. This is what I'm seeing on the ground. This is the impact on my patients. And if you want to talk about funding mechanisms, please feel free to call Lennie. But what I'm here to talk about is the impact on our community. And so I think that that's a great way to interact and to get your feet wet. Obviously, as we discussed, there are some advocacy committees. We have the GAC committee, which Belinda serves on beautifully, and we hope that she will stay and serve on other advocacy committees as we move through the system. But there is the RheumPAC committee, which if you want a hand in deciding where those funds go, that's a great one. Also, just to be clear, I know that advocacy can have a tinge of secrecy around it. I assure you there is none. All of the letters we send to Congress are on our website. All of our contributions are public. So, none of this is, if you're not on the committee, you won't know. But if you are on the committee, you can help make those decisions. So we have RheumPAC, the Government Affairs Committee. We have the Committee on Rheumatological Care, which really gets into kind of the regulatory side and in that space. And aside from that, you can come to us during annual meeting, and we're happy to discuss issues you're seeing in your community and just share with you the language you can use. A lot of times there's a big gap, a knowledge gap. You graduated from medical school and went into treating patients. Someone like me who's been doing this for a long time is able to translate for you the issue you're seeing into the policy that could help, so that you feel better about approaching a member of Congress, maybe when they're in the district at a county fair, or inviting them to your practice to do a visit and for you to explain what you're seeing. So we are also happy to provide resources and support and just have discussions with you about what you're seeing and how policy could help with whatever issue is plaguing you and your office and your patients. Because I assure you, public policy, for better or worse, has its fingers in every single aspect of the healthcare system. And there is a policy that could help that almost always.
And I'll say a few more things. Advocacy begets advocacy, okay? So even if you're not into rheumatology and you're saying, well, there's so many other things going on, go do it. Nothing's going to get done unless we raise our voices. We here in Pennsylvania, in the 2022 elections, the recent elections, 2022, we physicians came together to really speak out for causes and candidates that we thought needed to get elected to protect reproductive rights. Pennsylvania came dangerously close to having an amendment to our state constitution that would have led to an abortion ban. And doctors speaking out, so much attention came to us. We were followed around by reporters who watched us canvass. We were featured in various papers, Axios, Huffington Post. The Rolling Stones wanted to see doctors talking to patients and speaking out. And so anything you do, anything you find interesting, again, anything, climate change, right? How that affects our rheumatology patients. Voting, how that affects our rheumatology patients. So if you're interested, do it. You'll be surprised how far your voice can go. And just one more thing is the American Medical Association. For a long time, I just thought that they were the group that annoyingly sent me a lot of mail and seemed to figure out everywhere I lived, everywhere I moved. But they have a very influential voice at the state and federal level that informs, guides, and generates support for policies that advance a lot of the healthcare initiatives that we are also working on. I'll tell you, one of the first times I went to the Hill and we were talking to a staffer, after I finished my entire spiel, he looked at me and he said, well, where does the AMA stand on this?
Wow.
And that was a big aha moment for me, because if the AMA is with us, then it's going to mean more. But the only way the AMA is going to know what is important to us is if we are part of it. And so the more rheumatologists who join the AMA, the bigger seat we're going to have at the table. And so, after you've donated to RheumPAC, actually think about filling out the AMA membership. I feel like since I've joined, I'm getting less mail from them, if that's any incentive to join. But, the issues that they're dealing with, whether it's Medicare reimbursement, workforce shortage, they're even dealing with important things that we in rheumatology may not get to. Something that's I find really important is our mental health, and how many doctors don't want to access it because they don't want to let their state medical boards that know that they're accessing it, which is supposed to be reported. And the AMA is working to see that that doesn't need to be part of your state medical board renewal. So things like that really matter. So it's just taking a wider look at what's going on.
Fantastic. These are all incredible suggestions. I have here many ways of getting involved. Belinda, like you mentioned, anything locally that people are interested in getting involved. The ACR also provides opportunities with advocates for arthritis, with various committees, including GAC and Cork, the Government Affairs Committee and the Committee on Rheumatologic Care. There's RheumPAC that you can get involved in as being part of the committee or just donating to RheumPAC, and as well as getting involved with the AMA. These are all fantastic suggestions. And hopefully, little by little, we can work through these advocacy steps to actually get changes done in Congress to improve the lives of patients, to improve our lives as rheumatologists in taking care of these patients. And then everybody will be happier afterwards, right? That's the goal.
Absolutely.
Absolutely. And I would add, if you have any interest in this area, if you contribute a little bit to RheumPAC before the annual meeting, then you'll have access to the RheumPAC lounge. And here's a little secret tip. That's where all of the advocacy staff likes to hang out. It has coffee all day and comfortable places to sit and a view of the bay. So if you want to talk about any of this or have any interest, RheumPAC is a great, like we talked about, gateway to just being among people who have, they're literally putting their money where their mouth is when it comes to policy discussions. And so being in the lounge is a fun place to meet other members of the ACR that are participating in advocacy in other ways and are leaders in this space. So we hope that we will see you at an annual meeting in the lounge or elsewhere. You can find us elsewhere, but the RheumPAC lounge is it's got the best view most of the time, and it has swag, which is hard to argue with.
I love it. And that's also a great plug for Convergence that's coming up, and we're all very excited. Belinda and Lennie, thank you so much for your time. This has been a really educational, eye-opening, and really motivating discussion in advocacy and rheumatology. Thank you so much for joining us.
Thanks for having us.
Well, there you have it. A deep dive into the world of advocacy within the American College of Rheumatology. Certainly, the ACR has had some successes along the way, but they need your help to continue making progress on behalf of patients and rheumatologists. If you'd like to get involved, visit our website or check out our show notes, where we've included links to many of the initiatives that were discussed today. Thank you all for listening, downloading, subscribing to our show, and for rating us with 5 stars, or however many stars you think we deserve. You can find our show notes for this episode at acronair.org, Apple Podcast, Spotify, and on your favorite podcast app. Until next time, get out there and make your voice heard. And of course, stay healthy.